Skin health and appearance are not simply matters of beauty or vanity. They are reflective of systemic health, internal biological rhythms, and deeply intertwined physiological processes. When we talk about improving skin, we're essentially referring to enhancing the function and structure of the largest organ in the human body. That means to truly improve skin health, we have to think about cellular biology, hormonal signaling, circadian biology, environmental input, and behavioral protocols that modify the underlying systems. The skin operates on multiple levels as a barrier, as an immune organ, and as a sensory interface with the external world. At the cellular level, the skin renews itself roughly every 28 to 40 days, depending on age, nutrition, and hormonal status. Keratinocytes, the predominant cell type in the epidermis, migrate from the basal layer upward, differentiating and eventually being shed. This process, called desquamation, is essential for the turnover of dead skin and the maintenance of a healthy barrier. Now here's the critical insights. Skin health is not just about what we put on the surface, but what drives the turnover, structure, and repair mechanisms from within. So let's begin with nutrition, because it forms the biochemical foundation of every skin cell. First and foremost, hydration plays a non-trivial role in the appearance and texture of skin. Water intake impacts the dermal layer, influencing its turgor and plumpness. But beyond just the volume of water, the electrolytes, specifically sodium, potassium, and magnesium, help maintain cellular hydration and osmotic balance, which are essential for optimal skin elasticity. People who are chronically dehydrated or have poor electrolyte balance often exhibit dull, sagging, or prematurely aged skin, even if they use topical products. Dietary intake of essential fatty acids, particularly omega-3 fatty acids like EPA and DHA, can modulate skin inflammation, improve barrier function, and reduce conditions like acne and eczema. Omega-3s are known to reduce the expression of pro-inflammatory cytokines and modulate sebum production. Studies have shown that increasing dietary intake of fatty fish or supplementing with high-quality fish oil can lead to statistically significant improvements in skin clarity and texture over time. Equally important are fat-soluble vitamins, specifically vitamins A, D, E, and K. Vitamin A in the form of retinoids accelerates cell turnover and has long been a cornerstone in dermatological treatment for acne and photoaging. However, oral retinoids can be toxic in high doses, and their use should be supervised. Vitamin D, synthesized in the skin via UVB exposure, plays a role not just in calcium homeostasis, but also in antimicrobial peptide production and skin immunity. Lower vitamin D levels are correlated with increased incidence of inflammatory skin disorders. Vitamin E, an antioxidant, protects the skin from oxidative stress, while vitamin K assists in healing bruises and scars. Then there are the water-soluble antioxidants like vitamin C and polyphenols. Vitamin C is essential for collagen synthesis, acting as a cofactor for prolyl and lysyl hydroxylase, enzymes that stabilize and cross-link collagen molecules. Without sufficient vitamin C, collagen becomes unstable, leading to sagging, wrinkled, and fragile skin. A deficiency can manifest as scurvy, but even subclinical levels reduce skin resilience. Polyphenols from sources like green tea, berries, and dark chocolate exhibit strong anti-inflammatory and antioxidant properties that reduce UV-induced photoaging and improve dermal matrix integrity. Another major factor is glucose metabolism. Chronically elevated blood sugar levels can lead to a process called glycation, where sugar molecules bind to collagen and elastin fibers, rendering them stiff and dysfunctional. This leads to premature wrinkling, loss of elasticity, and a sallow appearance. Glycation end products also contribute to oxidative stress and inflammation in the skin. Controlling blood sugar through low glycemic nutrition, regular movement, and sufficient sleep helps mitigate these effects. Speaking of sleep, the role of circadian biology in skin health cannot be overstated. The skin has its own circadian clock, regulated by the central suprachiasmatic nucleus, but also expressing its own genes like B, MAL1, and PER. During the night, the skin ramps up cell proliferation, DNA repair, and barrier restoration. That means insufficient or poorly timed sleep interferes with these regenerative processes. Even a single night of sleep deprivation has been shown to reduce skin hydration, increase transepidermal water loss, and impair barrier function. Moreover, the release of growth hormone, which peaks during deep non-REM sleep, contributes to collagen synthesis and tissue repair. So optimizing sleep, especially the early night deep sleep, through proper light exposure in the morning, avoiding bright light at night, keeping a regular sleep schedule, and perhaps using temperature to facilitate sleep onset, has a direct and measurable effect on skin quality. Light itself is a fascinating variable. Sunlight, specifically UVB, is essential for vitamin D synthesis, as mentioned, but overexposure leads to DNA damage, photoaging, and increased risk of skin cancers. However, not all light is detrimental. Red and near-infrared light at specific wavelengths, generally between 600 to 850 nanometers, has been shown to promote collagen production, reduce inflammation, and improve wound healing. This is due to photobiomodulation, where light energy is absorbed by cytochrome C oxidase in mitochondria, leading to increased ATP production and modulation of reactive oxygen species. Some protocols suggest using red light therapy devices 2 to 5 times per week for 10 to 20 minutes, keeping the light source about 6 to 12 inches from the face. These sessions, when done consistently, can improve skin tone, reduce fine lines, and accelerate healing. Then we have the hormonal component. The skin is an endocrine responsive organ. For example, androgens like testosterone increase sebum production, which can be beneficial for skin moisture but problematic when excessive, as in acne. Estrogens, on the other hand, improve skin thickness, elasticity, and vascularization. That's why post-menopausal women often experience thinner, drier skin due to declining estrogen levels. Cortisol, the primary stress hormone, can impair barrier function, reduce collagen synthesis, and increase inflammation. Managing stress through tools like deliberate breathwork, cold exposure, resistance training, and social connection can downregulate the HPA axis and reduce the deleterious impact of cortisol on skin health. Cold exposure itself deserves mention. Acute exposure to cold, such as through cold showers or ice baths, leads to vasoconstriction followed by vasodilation, which improves circulation and lymphatic drainage. Some studies indicate that regular cold exposure can increase norepinephrine, which not only improves mood and energy, but also supports skin tightening and reduced puffiness. The cold acts as a hormetic stress, or stimulating adaptation and repair mechanisms. From a behavioral standpoint, exercise is one of the most impactful interventions. Aerobic and resistance exercise increase circulation, improve insulin sensitivity, and reduce inflammatory markers. Studies have shown that regular exercise increases dermal thickness and collagen content in older adults, making the skin more youthful at the cellular level. This may be due in part to myokines, signaling molecules released by muscles during exercise that have reparative and anti-inflammatory effects on distant tissues, including the skin. Topical skincare has its role, but it is often overemphasized in lieu of systemic interventions. That said, compounds like retinoids, vitamin in a derivatives, niacinamide, a form of vitamin B3, and hyaluronic acid can be effective when used correctly. Retinoids increase cell turnover and collagen production. Niacinamide improves barrier function, reduces hyperpigmentation, and has anti-inflammatory properties. Hyaluronic acid is a humectant. It draws moisture into the skin, but works best when applied on slightly damp skin and sealed with an occlusive or moisturizer. Cleansing routines should be gentle. Over-cleansing strips the skin of its natural lipids, disrupting the microbiome and barrier function. The skin's microbiome plays a crucial role in modulating inflammation, pathogen resistance, and barrier integrity. Harsh soaps, alcohol-based toners, and frequent exfoliation can disrupt the acid mantle and lead to dysbiosis. A healthy microbiome supports not only clear skin, but balanced oil production and resistance to environmental insults. Sun protection remains essential. Daily use of a broad-spectrum SPF 30 or higher reduces the risk of photoaging and skin cancer, but the type of sunscreen matters. Mineral sunscreens using zinc oxide or titanium dioxide are generally better tolerated, especially for sensitive skin. However, allowing for brief, unprotected morning sunlight exposure 5 to 10 minutes can help maintain circadian alignment and support vitamin D synthesis without significant damage. Let's also address environmental pollutants and air quality. Particulate matter, ozone, and cigarette smoke all generate free radicals that damage skin cells, accelerate aging, and worsen conditions like eczema and rosacea. Living in high-pollution areas can degrade collagen and elastin fibers over time. Using antioxidant serums and maintaining indoor air quality through filtration can mitigate some of these effects. Alcohol and smoking exert profound negative effects on skin appearance. Alcohol dehydrates the skin, disrupts sleep, and increases systemic inflammation. Smoking constricts blood vessels, reduces oxygen supply, and introduces thousands of free radicals with each puff, leading to early wrinkling, discoloration, and impaired healing. Eliminating or minimizing both behaviors is foundational for any skin optimization protocol. Finally, consistency is the most important variable in all of this. Skin health is a long game. Cells take time to turn over, collagen takes time to synthesize, and habits take time to reflect on the surface. Any protocol must be sustained for at least 8 to 12 weeks before meaningful changes are visible. What's often overlooked is the psychological impact of improved skin health. Better skin leads to increased confidence, which feeds back into behaviors like better posture, social interaction, and positive mood. This creates a virtuous cycle where physiological changes drive psychological benefits, which in turn reinforce healthy behaviors. So improving skin health is not about quick fixes. It's about understanding the deep biological systems, nutrition, hormones, sleep, light, stress, and behavior that shape our skin at the molecular level. By aligning our daily routines with the biology of how skin renews, repairs, and protects, we're not just enhancing appearance, we're building resilience from the inside out. The conversation around improving skin health cannot be complete without addressing the role of the gut-skin axis. The gut and the skin are in constant biochemical communication, mediated through immune signals, microbial metabolites, and inflammatory cascades. When the gut is inflamed or leaky, what's referred to in scientific literature as increased intestinal permeability, substances like lipopolysaccharides can enter the bloodstream, activating immune responses that ultimately impact the skin. This is seen in conditions like acne, eczema, and psoriasis, where an imbalance in gut microbiota, known as dysbiosis, is often present. Restoring gut health involves increasing microbial diversity and supporting the integrity of the gut lining. Fermented foods like kimchi, sauerkraut, kefir, and yogurt introduce beneficial bacteria that help crowd out pathogenic strains. Prebiotic fibers found in foods like garlic, onions, leeks, and asparagus feed those bacteria, enabling them to produce short-chain fatty acids like butyrate, which have anti-inflammatory effects throughout the body. In addition, minimizing the intake of processed foods, artificial sweeteners, and excessive alcohol can reduce gut inflammation and indirectly enhance skin clarity and tone. Another often underestimated contributor to skin health is the emotional state. Chronic stress alters skin physiology in multiple ways. It increases cortisol, disrupts sleep, impairs wound healing, and leads to behaviors like picking, scratching, or neglecting skincare altogether. Skin conditions themselves, especially visible ones like acne, rosacea, or vitiligo, can provoke emotional distress, setting off a feedback loop. Psychological stress increases levels of neuropeptides like substance P, which stimulate oil glands and inflammation in the skin. Therefore, interventions that reduce stress, such as mindfulness meditation, controlled breathing protocols, or even short, mindful walks in nature, can have measurable benefits on skin appearance by altering these neurochemical cascades. Breathwork, in particular, has been shown to reduce sympathetic tone and lower systemic inflammation. When the nervous system is in a parasympathetic state, often referred to as rest and digest, the body is more capable of directing resources towards cellular repair, digestion, and immune modulation. Box breathing, cyclic sighing, or even simple diaphragmatic breathing for 5 minutes a day can lower cortisol, improve heart rate variability, and support the regeneration of skin tissue through downstream hormonal changes. There is also an emerging body of evidence supporting the use of adaptogens, natural compounds that help the body resist stress, for skin improvement. Substances like ashwagandha, rhodiola rosea, and holy basil may reduce cortisol levels, improve antioxidant capacity, and support thyroid function, all of which are implicated in the quality of the skin. For example, individuals with suboptimal thyroid function often present with dry, flaky skin due to slowed metabolism and reduced cell turnover. By supporting the body's resilience to stress and optimizing metabolic rate, these compounds can be adjunctive tools in a skin health protocol. We also need to look at the mechanical inputs that affect the skin. Compression and shear forces, such as those exerted during sleep or habitual facial expressions, over time can lead to the development of lines and wrinkles. Sleeping on the side or stomach can cause mechanical stress on one side of the face, leading to asymmetry or deeper nasolabial folds. Some experts recommend sleeping on the back with a silk or satin pillowcase to reduce friction and preserve skin hydration. Similarly, becoming aware of facial tension during the day, jaw clenching, frowning, or squinting, can help prevent the formation of dynamic wrinkles, which become static over time. Another consideration is lymphatic flow. The lymphatic system helps clear interstitial waste, immune cells, and cellular debris from the tissue spaces. When lymphatic drainage is sluggish, it can lead to puffiness, dull skin, and even breakouts. Manual lymphatic drainage, facial massage, and even certain yoga postures that promote inversion can enhance this process. Gentle massage in the direction of lymphatic channels, starting from the center of the face and moving outward and downward, can improve circulation, reduce fluid retention, and stimulate detoxification processes in the skin. It's also important to examine the role of temperature and heat in relation to skin health. While heat can promote blood flow and aid in absorption of topical agents, chronic exposure to high temperatures, such as from hot showers, saunas, or direct sun, and break down collagen and exacerbate conditions like rosacea. Alternating between heat and cold, such as through contrast therapy, can train blood vessels to dilate and constrict more efficiently, improving nutrient delivery to the skin and aiding in recovery from inflammation. Let's also discuss collagen, the structural protein most associated with firm, elastic skin. Collagen makes up about 75% of the dry weight of your skin and starts to decline around age 25, decreasing by about 1% per year. This loss accelerates in postmenopausal women due to the drop in estrogen, a hormone that supports collagen production. Supplementing with hydrolyzed collagen peptides has been shown in several randomized controlled trials to improve skin elasticity, hydration, and dermal density. These peptides, when consumed consistently over 8 to 12 weeks, stimulate fibroblast activity and collagen synthesis by providing the necessary amino acid building blocks, especially glycine, proline, and hydroxyproline. Ingesting collagen works even better when paired with vitamin C and zinc, which serve as cofactors in the enzymatic processes of collagen synthesis. Bone broth, animal skin, and gelatin are food-based sources, while powders derived from bovine or marine sources are common supplemental forms. Ensuring bioavailability through hydrolyzation is key. This process breaks the collagen down into smaller peptides that are more easily absorbed in the gut. Another class of compounds that support dermal structure are ceramides. Ceramides are lipids found in the stratum corneum, the outermost layer of the skin, and they play a key role in maintaining barrier integrity and hydration. Topically applied, ceramides can reduce transepidermal water loss, soothe irritation, and enhance the skin's protective functions. More recently, oral ceramide supplement, often derived from rice or wheat, have shown promise in improving skin hydration and smoothness in controlled studies. Hormonal alignment is another layer of complexity. Hormonal acne, for instance, is often linked to fluctuations in estrogen, progesterone, and androgens, particularly dihydrotestosterone DHT, a potent metabolite of testosterone. In women, this often correlates with the luteal phase of the menstrual cycle when progesterone peaks. Managing these fluctuations through lifestyle and, in some cases, targeted supplementation or medical therapy can bring substantial relief. For example, spearmint tea has been shown in some studies to reduce androgen levels and improve acne symptoms. Similarly, balancing blood sugar can prevent the insulin surges that drive excess androgen production and sebum secretion. There is also a role for micronutrient optimization in skin repair and radiance. Zinc is vital for wound healing, immune function, and controlling inflammation. A deficiency can lead to acne, slow healing, and susceptibility to infections. Selenium is another key trace mineral that functions as an antioxidant and supports the activity of glutathione peroxidase, an enzyme that neutralizes peroxides and prevents oxidative damage in the skin. Ensuring adequate intake of these through food, like oysters for zinc, Brazil nuts for selenium, or via supplementation can have an outsized impact. Let's also turn to peptides and growth factors, which are increasingly used in advanced skincare. These bioactive molecules communicate with skin cells to initiate repair, increase collagen synthesis, and modulate pigmentation. Topical products containing copper peptides, matrixyl, or epidermal growth factor (EGF) are designed to penetrate the skin barrier and signal rejuvenation at the cellular level. These compounds mimic the body's own signaling mechanisms, often with fewer side effects than more aggressive treatments. And then there's the topic of pigmentation. Hyperpigmentation, melasma, and post-inflammatory dark spots often result from the overproduction of melanin triggered by UV exposure, inflammation, or hormonal changes. Agents like niacinamide, azelaic acid, tranexamic acid, and arbutin can help modulate melanin synthesis and reduce discoloration over time. More aggressive treatments like chemical peels or laser therapy may accelerate this process but carry higher risks and should be carefully considered. Speaking of peels and lasers, the skin's regenerative capacity can be harnessed through controlled injury, a principle known as fractional damage. Procedures like microneedling or fractional laser resurfacing create microinjuries in the dermis, stimulating a wound healing response that includes the production of new collagen, elastin, and capillaries. When paired with growth factors or platelet-rich plasma, these techniques can significantly improve texture, pore size, and tone, but they require proper preparation and recovery. Sun exposure, again, is a double-edged sword. While brief intentional sun exposure in the early part of the day supports circadian alignment and vitamin D production, chronic UV exposure degrades collagen and elastin fibers, leading to photoaging. UVA rays, which penetrate deeper into the dermis, are primarily responsible for aging and wrinkling. Broad-spectrum sunscreens and sun-protective clothing are essential, particularly for people with fair skin or a history of skin cancer. But the timing, duration, and angle of sunlight exposure matter too. Early morning and late afternoon light tends to be less damaging while still beneficial for circadian signaling. When considering topical regimens, less is often more. Overcomplicating a skincare routine with too many actives can lead to barrier disruption, sensitivity, and rebound issues. A foundational routine might include a gentle cleanser, antioxidant serum like vitamin C, moisturizer, and sunscreen in the morning. In the evening, incorporating a retinoid or exfoliant 2 to 3 times a week, paired with barrier. Supporting ingredients like ceramides or peptides can support renewal without overloading the skin. And while skincare products can certainly enhance appearance, none will compensate for a body that is out of sync, sleep, deprived, inflamed, or hormonally imbalanced. The goal is to create a biological environment in which skin can thrive, one of rhythmic inputs, nutrient abundance, psychological safety, and minimal toxic load. That environment is created not by any single protocol, but by a constellation of daily decisions: how we sleep, what we eat, how we breathe, when we train, how we manage light, and how we relate to our inner and outer worlds. The truth is, radiant skin is a byproduct of internal coherence. It's the visible output of an optimized organism. Skin doesn't lie. It reflects our state of hydration, our stress load, our micronutrient status, and our exposure to the sun, pollution, and time. The more we align with the systems biology of how skin regenerates, protects, and communicates, the more effortlessly we can influence its texture, tone, and resilience. These are not superficial pursuits. They're deep biological investments. In conclusion, skin health and appearance are not determined by surface-level solutions alone. They are the visible expression of a finely tuned internal system. The skin is a sensory organ, a barrier, a communicator, and a mirror. When we align our behaviors with the biology that governs its renewal, through quality sleep, nutrient, dense foods, smart light exposure, stress management, and well-formulated topical care, we create conditions for true transformation. This isn't about chasing perfection, but about honoring the science of regeneration and resilience. The glow people seek from serums and creams is actually the glow of a body in balance. When internal systems operate in harmony, the skin doesn't just look better. It becomes a signature of overall vitality.